What you need to know about hormonal pellet therapies with our hormone expert, Dr. George Moricz. Dr. Moricz, how did you get started in hormonal pellet therapy?
Well, Chip, thanks for having me here today. I'm going to back up for just a minute. It was 1997, and I was working with a doctor who originally trained in Italy. And all these ladies, these patients he was taking care of, they had gone through the change of life, menopause, they had hysterectomies, and he was placing these little tiny pellets. And whenever they came back to the office, I was his chief resident, they all sounded so young. I mean, they said they felt like they were 18. Their husband said that they were just completely transformed. And for years after that, after I left my training and went into private practice, never have I come across patients who felt so good, so balanced since they had taken, pellet therapy. Most of the people that I've seen have taken creams, they have done patches, they've done pills and shots, but never have they felt as good as the patients I first saw back in 1997 who were benefiting from hormonal pellet therapy.
So why does someone need hormonal pellet therapy or hormone therapy at all?
Well, that's a super question. It's possible that someone doesn't need hormonal pellet therapy or any hormonal therapy at all. What seems to happen in the body in both men and women is they get through their 20s and early 30s and there's this huge nosedive in hormones. If you think about hormones like the members of a basketball team, they're all supposed to be working together, these little chemical messengers, and they're secreted from organs, they travel through the blood, and they have vital functions for both reproduction, for repair, for feeling good, getting you to bed at night, and basically survival. Make sure that you can respond to the daily stresses, both physical and emotional, every day. So the reality is that we've seen what aging does to people. Aging is a change in an organism. So what happens over time is that these hormones nosedive, and ultimately that's when people get into trouble. So when I see people with hormonal deficiencies, a lot of times they come in with different types of symptoms. And we know that if, for instance, if you were a diabetic and needed insulin, we would give you insulin. If you had a low thyroid, the thermostat in your neck, you would certainly give them thyroid. Well, what we have started to figure out is that you can't just replace one hormone. In other words, just like the members of a basketball team, you can't just focus on one player. You have to get all the players working together. So the second part to your question is, who needs it or why do you need it or not at all? What we try to do at Body Hormone Balance is we sit down and we do a functional questionnaire. We look at all your symptoms. We try to see how you sleep, how your energy, your metabolism, basically how you function daily, more detailed than any doctor's questionnaire that you've ever seen. Then what we do is we do a panel of hormones, tests that doctors generally don't test. And we start from the brain hormones and work all the way down to the stress hormones and the reproductive hormones. Then we match them with the questionnaire and figure out where those deficiencies are. So then I sit with patients and we figure out our plan of attack. And usually it comes in several different layers. So getting back to what you were asking. So if you have a hormonal deficiency, you have symptoms, then you have to figure out if it's appropriate to give hormones. And for some patients, they may not need them. But for a lot of other patients, they've gone through the trial of taking the pills, the patches, the injections, and they're noticing that there's a lot of problems with them. And in general, if you look at different mechanisms of taking hormones, is that they have peaks and valleys. They don't last long enough. Sometimes you have to dose it twice a day. So why hormonal pellets? Well, if you take a rice-sized grain, and that's what these pellets look like, and in a small procedure in the office, you place them in the hip area. These can give a steady state of hormones. They're compressed little pellets, and so they release the hormones. And as you metabolize more, you wear them out quicker. So 2 or 3 times a year, patients will come in and get these pellets.
So people that might be more active in their lifestyle might go through more pellets than another.
That's correct. And, if we step back in the bodybuilding literature, we've noticed that very muscular men, for instance, they probably deplete their stores of testosterone quicker and they need higher doses. And that's also true for both men and women who are more active. In other words, these compressed little pellets, as you metabolize more, as your blood flow and heart rate go up, you can actually consume more of the hormone as you get through your day.
Well, Dr. Moricz, who do you find is more a susceptible candidate for hormonal pellet therapy? Young men, older men, younger women, older women? Who does it work better for?
Well, I'll speak to one example because that is just very insightful. If you look at men, and years ago we used to look at things like sperm count and testosterone levels, like in our grandparents, we used to notice that they used to have a drop-off in hormones, but what we're finding is that that's happened a lot earlier. You would wait for men in their 70s and 80s to have a big drop-off in hormones. I'm seeing patients as young as their 30s and 40s, and they have a much earlier drop-off. And some of these gentlemen have trouble with fertility, some of them have sexual dysfunction, but most of them will develop things like diabetes, early heart attacks, even higher risk for prostate cancer. So in the case of men, for instance, you may see that. Women as well. I mean, you're going to see a wide range of patients. A lot of times people get through their 20s, and as they head through their 30s, they just have a big nosedive in their energy. And what we're finding is that it's really a combination of multiple hormones working together, and these deficiencies basically activating the symptoms even further. And so it's probably a better idea to do the evaluation early. In other words, let me give it a different example. If we're all 18 years old, we're sitting around and we don't sleep right, we don't eat right, we basically do a lot of things that aren't correct, and yet we get up the next day, we haven't gained a lot of weight, we have tons of energy, and we're good to go. Well, if we were to measure our hormones at age 18 and then maybe do it in our 40s, 50s, and 60s, we'd notice a big difference. And although it's only a theory, but in reality, one of the causes of aging may be the lack of hormones.
So would you say that hormonal therapies, as you call it, body hormone balance, having a good balance of hormones within the body and using the pellet therapy, is that more of a preventive measure or is that more of a cure measure?
Well, once again, a super question. We don't know that hormones actually cure any illnesses, but we do know, for instance, and I'll have to give examples, in both men and women, as we lose our male hormone production, and this is even true in women, our bones thin. We notice that, what is older age? I mean, when we look at patients in a nursing home, we notice how frail they are. We notice they've lost a lot of their cognitive function. And what we're finding is that a lot of these patients are actually low in the hormones that help keep you fit, what we call anabolic hormones. So if you want to keep your muscle strength, your bone mass, things like male hormone, growth hormone, stress glands, and proper thyroid levels are very, very important.
Dr. Moricz, what's the history of the hormonal pellets? How did they get started? How did you find out it was effective?
I first came across it personally in my clinical training in 1997 when I was working with a doctor who trained in Italy. But what I later found out is in the 1950s and 60s, doctors were already using hormonal pellet therapy. One of the things I think that probably prevented from gaining widespread acceptance was the FDA. But doctors were taking these compressed little hormone pellets and placing them in patients, and they were having great results. In other words, in women, they were avoiding that roller coaster effect of taking hormones and a drop. When you take women who have trouble with like breast tenderness, mood swings, and depression, and you give them a steady state of hormones, in other words, there's no peaks and valleys, what happens is that they just do wonderfully. I mean, they don't get the headaches, they don't go through that roller coaster effect.
Let's say that I was experiencing some of the symptoms that you had talked about earlier, but how do I find out if I'm a candidate for this type of therapy?
Well, what you would do, we would sit down with our body hormone balance liaison, and what she will do is she will go through some of the questionnaires, she'll go through those, and then she will discuss the structure of the way that we check laboratory studies. And once you do the laboratory studies and go through this functional questionnaire, you put the two together, and that's when the doctor, as an expert in hormones, can come in and basically start to look at what might be the most important hormones to replace first. You don't always have to replace hormones, but if you're going to do them, you have to have a real plan of management, and you want someone who can handle the interaction of different hormones. Some hormones help each other and some work against each other, and you need someone who's experienced in looking at hormonal symptoms and tweaking the body so that, just like a fine-tuned race car, you have to know if you change one parameter, what to do with the next.
Dr. Moricz, I'm a juvenile diabetic. And if I were going to take this hormone therapy, how could I expect it to help or to hurt me?
There was a study done, and there are ongoing studies done in type 1 diabetics. We call basically type 1 diabetics juvenile, as you've described. Type 2 is the one that you develop later. A lot of family members know someone who's a type 2 diabetic. Your actual insulin usage is actually less with male hormonal therapy, and that's just incredible. There have been studies done where they actually showed that you actually use less insulin because testosterone seems to be an insulin sensitizer.
Dr. Moricz, let's say I came in and we did the test and found out that, yes, I was a candidate for hormonal pellet therapies and getting my hormones all in balance. How quick would I see a result, and how would I know if the results were positive, negative, and how quick would I know that things were turning around?
Chip, I'm really glad you asked that. What will happen with the hormonal pellet therapy, if I placed it today, usually within 30 days there'll be a slight peak of the hormonal effect, and then over the next 4, 5, and 6 months, you'll have a sustained release. So likely you'll have the greatest noticeable difference within 6 months, but as early as 1 month.
Dr. Moricz, what are some of the symptoms that hormonal pellet therapy helps the most, maybe?
Well, Chip, that's another outstanding question. In the case of women, for instance, a lot of women will go through the change of life, and sometimes they go through the hot flashes and flushes, kind of the power surges in their body where their core temperature changes, but also their mood, their energy levels, and sleep. Now, for men, a lot of times sexual dysfunction, there have been studies done, and that's probably the earliest sign that they're deficient in male hormones, is having trouble with morning erections, sexual performance, and just not feeling that edge that they used to have.
Is this something that's going to, have an effect on me, sort of like the fountain of youth?
Well, we don't know that hormonal pellet therapy or any hormonal therapy is necessary for everybody. Some of my patients do well with injections, and there are maybe some advantages initially to fine-tuning things. For years, they were looking at different hormones as the fountain of youth. We went through a phase several years ago where we looked at what's called an adrenal hormone called DHEA. That was looked at as the fountain of youth. And what we were finding is that people who had died of immunologic disorders, had earlier cardiovascular disease, had very low levels of this hormone. Then several years later, they started looking at growth hormone because they were noticing that took a big nosedive as well. And this, as you can guess from the name growth hormone, it helps repair and grow cells. And so studies have looked at that as well. We don't think that we have the fountain of youth hormone. It's probably a combination of hormones, and while they haven't worked out the exact ratio, we don't know that aging is abnormal in itself. In other words, maybe we're supposed to have a drop-off in hormones, and it's not maybe always important, to replace everything at once, and we certainly don't want to overdose on certain therapies. I think the advantage with the pellet hormonal therapy is it gives it a steady state, and if you watch the lab values very, very carefully, you're not likely to overdose, but it does require some monitoring. So is it for everybody? Probably not. Is it an option for people who've tried other things and were having reasonable success, but just didn't want to deal with the day-to-day or every week application of different medicines? My feeling is that as our technology grows and we have more data, we'll probably figure out at what point in our lives to introduce what hormones with minimal risk and how to layer it with other hormones so that we can fine-tune physiology. I mean, let me go off on a totally different tangent. They've done genetic studies and they're looking at all our DNA in our body, and they're trying to map out at an early point in our life and predict to you, your brothers and sisters, what disease processes may affect you. What the neat thing that we're finding is that hormones have immune system control. Because, it's funny, when you're 18, a lot of things may bombard your body, the environment, you may be hit with viruses, bacteria, but you recover. And what we're finding with even things like melatonin, DHEA, and growth hormone and testosterone, especially for the immune system, is that they actually may protect your immune system. So hormones are not just chemical messengers that may make you feel good and build your muscles and bones, but in fact, they may actually affect your immune system. And there are some very detailed studies that we can't go into today that are actually showing in mammals and in humans how the immune system is affected by a certain balance of hormones. I'll just go one further because this question is such a neat question that it deserves a bigger answer. For instance, hormones. In women, we find things like rheumatoid arthritis. Why in women? Well, we think it's because they have less testosterone and more estrogen. So women are at a disadvantage for certain autoimmune disorders. So we do think that hormones in the immune system are very much interrelated. It's just figuring out at what point do you intervene with hormonal therapy and decrease the breakdown of the body.
Dr. Moricz has some great information. What other services do you offer with your practice for evaluating and treating hormones?
Well, the Body Hormone Balance Program is a very unique program. We have a number of all-inclusive programs. For weight management, we do rapid weight loss. We do the dynamic hormonal balance evaluation for men and women. And so as part of evaluating hormones and weight, we have a number of individualized programs. We also have a specialized line of FDA-approved meal replacements. We have nutraceuticals. The main goal of Body Hormone Balance is to take the individual and the problems that are affecting them and try to come out with the most precise plan so that you're only taking the things that you need and so you can succeed in a very predictable fashion. I mean, that's really the goal. Now, I have had patients who came in and were undiagnosed with multiple problems, diabetes, autoimmune disorders, and they were just grateful that I was able to look at their hormonal balance and figure things out for them. But we just have a wide range of services for the patients out there who have computer access. For the women, look at www.healthytexarkana.com. For the men, it's www.feelgreattexarkana.com. Now, if you're wanting to find out more information, and this is just the tip of the iceberg, make sure you contact our office at 903-794-6962. That's 903-794-6962 for a complimentary evaluation with our Body Hormone Balance Liaison. She will sit down with you, go through all your questions, and let you know everything that we can offer to help you.
Thank you, Dr. Moricz, for being with us. Ladies, renew your inner vitality and wellness. And men, reclaim your youth with Body Hormone Balance.